Okay, Module 11, Providing Good Nutrition in this book. It starts on page 99. Okay, and here's the need to know words, and I'll go through them with the PowerPoint here. Okay, so we're looking at basic good food groups, explaining the importance of good nutrition, discussing changes in behavior that may be related to improper nutrition, and explain how to prevent complications from dysphagia. Okay, good nutrition. It maintains body functioning, increases the ability to fight off infections. And poor nutrition, health problems, including infections. And so the other health problems, the main ones are diabetes, diverticulosis, could be cancer, but also infections. And also it may be related to your behavioral changes. Okay, understanding nutrition. So unmet nutritional needs may lead to lack of energy, lack of interest, lack of appetite, and irritability, fear, anxiety. Okay, so let's understanding nutritional needs. That's what we're on. So just so you know, there's the same nutritional needs for elderly and the young. The elderly, though, need fewer calories. So they still need nutrition, but they need less calories. And because the elderly, their resting metabolic rate, that means while you're sitting around doing nothing, it slows down and your body burns fewer calories at rest. And this is primarily due to hormone changes, not increases, it's usually decreases, hormone changes, decreased muscle mass, and less physical activity. Um, but it's a complicated, it's not just one reason. It's a series of reasons as you get older. And in your book is emphasizing a low saturated fat because you'll decrease the risk. So I should put that. Will decrease the risk of hypertension or high blood pressure, heart disease, strokes, and certain cancers. Michelle Obama actually changed what was on the website for the government, and it's called My Plate. So it's www.choosemyplate.gov, and there's a lot of information there, and there's recipes. So if you have to cook for someone, I suggest you go to those recipes, and they're easy ones. But the picture here is the best part. And what I want you to remember is half of the plate is made of fruit and vegetables. So that means you eat 3 meals a day generally, breakfast, lunch, and dinner. Half of the plate should be full of fruits and vegetables. A quarter is going to be grain, and another quarter is protein. And then you have your dairy off to the side. So they're showing 1, 2, 3, 4, 5 food groups. And the grain should be, I think they should all be whole grains, but that's almost impossible to do. And you want to try to use low fat or skim milk and milk products. Okay, so here's the 5 food groups again. The vegetables should be a variety of colors, so it should be not just the light green, but dark green and oranges and reds. Fruits, same thing, variety of colors. Fresh, frozen, canned, and dried fruits. At least they're fruits, but watch the canned ones and because they often take off the skin and things. So if you buy peaches, there's no skin on it, and there's always nutrition in those skin and they often have less fiber once they're canned. Um, and the dried fruits have more sugar because they take out the fluids in it. Okay, and then the grains. That should be, again, whole grains are the best. And grains would be food made from wheat, rice, oat, cornmeal, barley, or other cereal grains. So that's your breads, pasta, oatmeal, and breakfast cereals. There's breakfast cereals and breakfast cereals, though. Let's do oatmeal. We've got the quick oats, right? You just pour water in. Then we've got the 1 minute oats that you just cook for a minute. Then we've got the regular old-fashioned oats. Then we have the steel oats. Well, the one that breaks down into sugar very quickly is the instant one that you just pour water in. If you have the steel oats, it has a what they call a lower glycemic level. It breaks down into the final product of glucose or sugar at a slower pace. And when things break down at a slower pace, it usually they say 1 calorie equals other calories, but it doesn't. That's not what all the research is showing. There's calories from whole grains like the steel oats, and then the calories from those instant things. Okay, dairy. You should get milk or foods containing milk products in them and try to get the lower fat. Okay, so the My Plate food groups doesn't include oils. They talk about them because oils provide essential nutrients, and they come from plants and fish. But the USDA, the United States Department of Agriculture, includes them as a food pattern, not a food group. I disagree with that because they you need oils that helps the absorption of all these other nutrients. But oils that are fats that are liquid at room temperature. So the oils are something that are liquid at room temperature. Okay, skipped one. Um, okay, this is from the MyPlate website, but you could put your age, how much you exercise, your gender, male or female, and it'll tell you how many calories that you should have a day. So this is for an older adult that's exercising less than 30 minutes a day. So a female would only need 1,600 calories a day, which equals 2 cups of vegetables, a cup and a half of fruit, 5 ounces of grains, protein 5 ounces, quarter pounder is 4 ounces, right? And dairy 3 cups. And the males usually need more calories, primarily different hormones, but they also have a bigger muscle mass. Okay, so one of the things I want you to learn in this class is that doctors are going to develop these therapeutic diets for residents. That means they're prescribing a special diet for them so they don't get sick. Okay, so one of them we talked about was already the low fat. Okay, and I added that here, low fat saturated fat diet, often known as a low fat diet, but now we know that it's really should be low saturated fat. Saturated fats are the fats that are in meat and poultry primarily. Okay, but other examples, salt restricted or a low sodium diet, and then so some you're changing the food, some you're changing the consistency. In mechanical soft, you want your food soft, so more like a meatloaf consistency. Pureed, you want to even ground down more than a meatloaf. A diabetic diet, you need to change what you eat. And we're going to go through all these. Low saturated, we talked about clear fluid diets. We're not going to go over, but that's when you can have any fluids that are just clear, such as apple juice and water and tea without milk. And full liquids would be all the liquids you could have. Soft is comparable to mechanical soft. It's just so that it's easy to chew. So people that don't have teeth or their dentures don't fit right. And bland restricts some of the heavy spices that we use. Okay, we're gonna talk about the diabetic diet because diabetes is rising in the United States as is in the rest of the world. And this causes so many problems. So I want to go through the problems it causes first. Uncontrolled diabetes or long-term elevated blood sugars, which your blood sugar gets higher in diabetes, and blood sugar is called blood glucose. It you increases your heart disease, kidney disease, and sends you into kidney failure. Most of the people that go to dialysis are diabetics. Um, Blind, you could go blind. You amputations. If you see below the knee amputation and it's someone in a dialysis center, it's probably because of diabetes. And I only say that because with the wars, people have had their legs amputated from IEDs. And nerve damage and pain in the feet because the nerves are damaged, like pins and needles in your feet all the time. And as we saw with COVID, it increased the risk of COVID because of these cytokine storms. You don't have to understand, but your body's always got inflammation in it. And so people couldn't fight off the COVID, and those are the people that often went to the hospital. Okay, a little cute picture because diabetes, this is sugar that we want to keep out of the diet on a roller coaster because your blood sugars are hard. It's not easy for someone with diabetes to keep their blood sugar controlled. So as much as we say, oh, control your blood sugar, it's up and down like on a roller coaster ride, and medications are hard to control it with. Okay. So, I'm going to go through the normal use of glucose that your body uses. Okay, in the normal person that does not have diabetes, this is the way it works. A person eats carbohydrates, so it's the carbohydrates that's affecting. Carbohydrates we know as carbs. Carbs break down into glucose, which is a sugar. The glucose goes from your digestive tract into the bloodstream to deliver sugar to all the body. But for the sugar to get into each cell, it needs insulin, which is a hormone, carries the glucose into each cell. So it's kind of, I think, like each sugar, each insulin is a little taxi cab that's going to drive the sugar into each cell for nutrition. So that's a normal person. Okay, now a person that has diabetes, what does it do? The carbs break down into glucose, right, in your digestive tract. The glucose gets into the bloodstream from your digestive tract, and they try to deliver sugar to all the body cells, but the insulin, that hormone, is either not present or does not work correctly and cannot carry glucose into the cell. So because it can't get into each cell, the glucose stays in the blood and it increases in the blood and because it cannot get in the cell. So high glucose in the blood is called hyperglycemia, and that's what causes the complications. And one of someone who had diabetes said the doctor explained it to him like this, that um, it's like having the sugars, like having little shards of glass floating around in your bloodstream, and it's ruining all your blood vessels. And I think that's a good way to think of it. Okay, so remember, for the people with diabetes, animal and fish proteins do not have carbohydrates in them, so they can be eaten by people with diabetes. So I'm just saying that to emphasize it's the carbohydrates we're worried about and concerned about. Okay, um, so when we're eating carbohydrates, if because there's all levels of diabetes. Some people are pre-diabetic, they're not diabetic yet, but they're watching what they eat. Then there's the people that are on oral medicines to help the diabetes and help the insulin work. And then there's those that don't have any insulin or their insulin is completely, they call it insulin resistance. It's like having all these taxi cabs with broken tires, right? They're there, they work somewhat, but not very good. Okay, so um, for the people that have diabetes, we want to try to find things with low glycemic index, low glycemic carbohydrates, carbs that break down into glucose slower. Veggies, anything with a lot of fiber is good. Veggies, nuts they have protein, but they don't have a lot of carbs in them. Whole grains, sprouted grains, and then fruit has more sugar than veggies. However, if you get the ones higher in fiber, like apples and pears, they will be better than like a banana because that doesn't have any fiber. And just so we could see different colors, that's what we're talking about with your vegetables and fruits. Actually, tomatoes are fruits. That's what you want people to eat. Okay, what do we want them to limit? The things that are high sugar contents or high glycemic, break down into glucose quickly. So refined carbohydrates, your white bread, white rice, um, most of your breads. Sugar juices or just juices. I mean, freshly squeezed is better, but it's still high. And totally eliminate drinks with high fructose corn syrup. It is a sugar that the brain doesn't even recognize. So, and then you want more. It's crazy how it works. And just so you know how we've gone up from diabetes from 1980 through 2010, it increased by 176%. Well, we have more sugary drinks, but we also started using high fructose corn syrup, which the brain doesn't recognize. At least the brain recognizes sugar and says, okay, that's it just recognizes it in a different way. Okay, if we have hyperglycemia, high blood sugar, we're going to have symptoms of increased thirst, frequent urination, and being hungry. Hunger. So these are the ones: extreme thirst, hunger, and frequent urination. Those are the ones that are most visible, but dry skin, blurred vision, drowsiness, nausea are all symptoms.